We're going to start with warm-ups, simple glute bridges to help bring the blood flow to the musculature around the knees. So in this glute bridge, you're going to spread your feet out, squeezing your glutes before you lift your hips up to the ceiling. You want to try to get the feeling in the glutes, not feeling anything in the hamstrings contracting. So squeeze the glutes, press up. Now rise on the balls of your feet to get those calves in there as well. Slowly lower. In the warm-ups, it's all about active, dynamic warm-ups. We want to move the body, warm up the tissues, warm up the ligaments, warm up the joints by bringing blood flow to the area. Really important to squeeze those glutes because that's going to be a huge component of today's exercise, because we are going to be focusing on hip stability to help with knee stability and ankle stability to follow. And squeeze your glutes, squeeze them so much that that is what lifts your hips off the floor. That's what you want to think. Go up onto your balls of your feet, rise up onto your toes and hold. Keep holding. Really feel those muscles burning, getting that blood flow there, getting those tissues warmed up. Make sure to breathe in through your nose, out through your mouth. Hold, hold, hold. Breathe in through your nose, out through your mouth. Keep holding, keep holding. Develop those stabilities, wake up all those fibers. Keep holding, breathing in through your nose, out through your mouth. Slowly lower your heels and rise up and down. So holding that glute bridge position and rising up and down on your toes. Really squeezing those glutes, activating that posterior chain, the musculature in the back, keeping those hips raised up to the ceiling, squeezing the belly button to the spine, maintaining that core position. And slowly lower. Hug your knees towards your chest and gently roll side to side. Now you're going to roll onto your side. We're going to get a little bit of core and glute med, TFL, IT band activation. So when you're in this position, you want your elbow directly underneath your shoulder when you rise up onto your knees, keeping those hips up, and you don't want them up too high and you don't want to twist forward towards the floor. Imagine you are in a hallway that's real close to your back and your front, and if you roll too forward, you're going to hit the front. If you roll too far back, you're going to hit the back wall. So you want to maintain in that perfectly neutral position. So you're seeing my top leg rise here. You can rise it a little bit to align with the other hip. I find that more natural, so that's what I'm doing here. But if that's too difficult for you at this point in time, you can just keep your knees together as you lower and lift your hips. Just make sure you have no pain or discomfort as you hold here, reaching your arm overhead, squeezing that belly button to your spine, keeping those hips lifted to the ceiling, and making sure that your head is in line with your sternum, in line with your belly button, in line with your pelvis, in line with the middle of your knee. Hold, hold, hold. This is really setting the base for our exercise that we're going to be doing today. So this is what's known as prehab exercise, where we specifically target and wake up the musculature that we are wanting to activate the most during these stabilization exercises. Flip on over to the other side. Again, remember, get that elbow right underneath the shoulder, those knees in line with the spine, and raise up and down with the hips, up and down. Again, I'm lifting my top knee up to align with my hip joint on the top socket, and feel free to do that if that feels easier for you as it does me. And keep your core nice and tight. As you see, I'm not moving my head much. I'm not moving my chest much, and I'm not really moving my core. I'm only moving within my hips. Now hold here, reach up and over your head. Really feel that contraction of the side of the glutes, the IT band, the TFL muscle, the core, even the neck muscles, and of course the shoulder. So we're really getting at that lateral chain now. Breathe in through your nose, out through your mouth. Remember to breathe. And if at any point in time you find these exercises too difficult, you can stop the video, you can pause, and eventually you're going to get stronger. So now we're going to really further try to activate and wake up those glute muscles. So we're just going to be going back and forth with the leg. So bring the knee up towards the chest and then lifting up directly to the side, up to the ceiling. So we're driving that heel up to the ceiling in that position and bringing the knee towards the chest. So the key here is I don't really want to move my core too much. I don't want to move my body. I'm just focusing on the movement of the hip. So again, the focus here is to bring blood flow to the musculature that we want to activate. And we also want to really establish your feelings of that muscle so you know what muscle you should be feeling when you're doing the other exercise. Now hold here. You're really going to get a sense of what muscle you should be feeling when we're about to do these following knee stabilization exercises. So try to keep that leg nice and straight. Feel the burn into the side of the glute. And now switch sides. Again, keep that body nice and still. Leg out to the side, lift up, drive the knee up, and lift up out to the side. Bring the knee up, and lift the knee up. Please excuse my cat. She's all excited thinking I'm playing with her. And keep going, almost done. And hold. Hold, really get an appreciation for that glute. And just notice, is it easier to do one side versus the other? Why is that? Are you more right dominant? Are you more left dominant? These are all things that you want to pay attention to because weaknesses and imbalances like this are the highest determinant for injuries. So as best you can, you want to try to even yourself out as best as possible. Now shake it out onto your back, rotating your knees side to side. We're going to move on to our actual knee stabilization exercise. So this is very, very basic here because what we're doing is I'm just training you to do the hip hinge with a very, very slight quarter squat with the knee. So you want to imagine in this particular exercise, shifting the hips back first, leaning forward as if the top of your head aligns with your upper back and aligns with your tailbone. And then you're just going to slightly sit back and do a quarter squat with your knee. Again, leaning forward, hip hinge, slight bend in the knee, trying to keep that knee right over the ankle. And you should be feeling that big toe driving right into the floor. So you want to imagine the foot is like a tripod. The big toe, the base of the pinky toe, and then the heel, that tripod. So the best way that I can cue you here is you want to try to press the base of your big toe into the floor. So you don't want to scrunch your feet, but you want to press the base of the big toe into the floor when you're doing this exercise to maintain that quad or that tripod stance. This gives a good base and starts to train your ankle to stabilize your knee and therefore stabilize your hip. Because the stabilization should be coming from above the knee at the hip and below the knee at the ankle. So it's important that we work both very gradually with the basics here. And of course, make sure that you're not letting your knees fall in. You want your knees to be driving out, away from the midline. So leaning forward, bending at the knees, keeping those knees over those ankles, and coming up. Hinging forward, bending at the knees, trying to keep those knees out, knees in line with the second toe. And you're just going to keep repeating that. So squeezing everything, get that tripod, feel where your feet are, feel where your knees are, feel where your hips are. And hold this, get a sense, and come up and shake it out. Now we're going to move a little bit onto something more difficult. We're going to do single leg quarter squats. So again, keep that chest up, hinge forward, quarter squat, tap that heel down. So again, this is the position that you should be in. Trying to show you from all different angles. So we're just going to go through this nice and slow so you grasp the movement. So keep that heel up, hovering at about a few inches off the floor. Slightly lean forward, quarter squat in that knee, tap the heel down, making sure that knee stays right over top of that second or third toe. I'll show you from a different angle here. Again, lifting that heel up, slight lean forward, slight bend in that knee, tapping the heel down, holding, really feeling that contraction of all tripod stance in the foot, the knee stabilizing, and the hip. Shake it out, shake it out, shake it out. We're going to go on to the other side. So keep your core nice and tight. The opposite foot. Lean forward at the hip. Keep your head in line with your tailbone. Keeping that core tight. Quarter squat. Tap that heel down. It should be just hovering like a millimeter off the floor. And chest back up. So that if you notice, my chest and my hips are coming up at the same time. And as I demonstrated there, you don't want this movement to just come from the knee. It's important that you shift those hips back. That hip hinge movement is super crucial to take pressure off your knee. So hip hinge first, then a slight bend in your knee. Again, this is very basic, very slow, repetitive, but establishing the basics and making sure you have the basics down pat is what determines your strength in the long run. Because if you just say all of a sudden do squats with a bunch of weight with bad technique, you're going to get injured eventually and you're going to be strengthening your weaknesses. Whereas if you learn your basics very well, you're going to be extending your career as a recreational athlete or as an athlete for the long term. And come up. Take a little bit of a break. Lift up again, hinging forward at the hip. Slight bend in the knee, tap the heel down, hover, maintain. Tripod in the feet, stabilization in the hip, and shake out. Now back over to the other side. A little bit more advanced here. Hinging forward, tapping down. You want the heel now to hover completely off. And try not to put the heel back down to rest. So keep lifting it up the entire time. Quarter squat down, keeping that heel hovering an inch or two off the floor. So before you could rest, or maybe it was a millimeter off, but now you want to maintain that balance the entire time. So this balancing work, it's important to keep your hips steady. You don't want to be lifting your hips up too much, and you don't want to let your hip drop. You want to maintain a nice neutral line the entire time. So we're optimally working that glute max and glute med muscle to stabilize that hip and that knee, and therefore that tripod stance to stabilize the ankle and the knee and the hip. So really feel that knee driving out. Do not let that knee come in. It's very important that you focus on that. So there's a lot of moving parts here. There's a lot of different components to respect here. So if you need to pause the video at any point and do this movement in front of the mirror so you can see exactly what's going on, or maybe you even want to record yourself from different angles so you can see and assess and compare it to me to give you a good idea of what you need to do to correct yourself in order to make sure that you have proper mechanics. So now switching sides, keeping that other heel hovering now, coming up, and try not to put the heel down, just hover it. Really work that glute med on the other side. Again, keep that heel hovered, quarter squat, core nice and tight, tripod stance, pressing the base of the big toe into the floor, squeezing up hips and chest come up at the same time, keeping that foot off the ground. And just keep repeating that pattern as best you can. This is not a walk in the park, even though it looks easy. You may be surprised with how you don't feel balanced, or maybe how one side feels obviously easier than the other side. Again, the more you practice, the more you put this to the test for your body, the better and better you are going to get. And again, I'm just showing you different angles here, so don't worry about turning like I am. I'm just trying to show you so you can get an idea of what your knee should look like, what your shoulders should look like, legs, feet, hips, everything. Again, chest and hips rise at the same time, keeping that glute. So again, here's what it looks like when you drop your hips. We don't want that, and we want that nice, light, nice lift. And keeping that knee out, fighting to keep that knee out, and shake it out. We're going to do a little bit forward and back. So I refer to these as teeter-totters. Again, we still want to establish that base. Don't let that knee fall in. So keep the knee out, right over the toes. Heel in line with the hips, in line with the shoulders, in line with the head. So you don't have to do this position. I'm just showing you the line that you want to maintain. Again, if you have a difficult time doing this, you're losing your balance, or you're not sure if you're doing it right, pause the video, do it in front of a mirror, or get your camera out on your phone, record yourself and see and compare to see if it looks like me. Now this is just, again, sticking with the quarter squats, very basic movements, but can be challenging. Again, lift up, slight bend in the knee, hinging forward at the hips, maintaining the stability at the knee and that ankle, trying to minimize wobbling as much as possible. So these exercises are great if you're, in skiing season or really in any type of sport, because the knee is between the two longest bones of the body, so it's usually the joint. If there's going to be an injury in the lower body, usually it is that joint, because it's vulnerable, because like I mentioned, it is between the two longest bones of the body. So when you can work on these types of exercises to maintain stability at all sorts of different angles and ranges of motions and positions, you're training your body to maintain its positioning and stability while being comfortable in all those different angles, positions. So these are great prehab exercises. And come back up. Lift the leg up again. Slight bend in the knee. And hinge forward at the hip, keeping the heel in line with the rest of the body, keeping that knee out. And coming back up. And give yourself a second rest. Lift up again. Slight bend in the knee. And hinge forward. You see how my hips are staying perfectly parallel to the floor? I want yours to do that as well. Again, I highly encourage you to record yourself to compare it to me. And just finish off the last two here. You know the drill. Keep everything parallel, straight, balance, keep the knee out, tripod, hip stability, core tight, heel in line with the rest of your body. Rest slightly. And repeat that one last time. Now this last exercise may be a little challenging. You want to imagine a clock, 12 o'clock, 3 o'clock, 6 o'clock, and 9 o'clock. You're going to just bend as far as you can comfortably. So I'm showing you from different angles here. Again, remember that hinge at the hips. You're going to be bending at the knee after you hinge, and you're going to try to bend down as far as you can. Again, now if you're just doing this the first time or the first few times, I recommend just sticking with that quarter squat or half squat, not the full squat like I am. You can gradually build up to this. Now here is from a different angle. Again, remember that tripod. Bend forward, try to reach as far as you can with that floating leg. Out to the side, keeping that knee out, that hip stabilized, and back, reaching back as far as you can. Try to maintain that balance. Knee out, cross, knee out, knee out, knee out, and up, and repeat. Down, out to the side, reach as far as you can. Again, within reason if it's the first few times you're doing this. And 9 o'clock, and relax. So now switch sides again, chest up, hinge at those hips first before you reach as far as you can. 12 o'clock, in this case 9 o'clock, 6 o'clock as far as you can, keeping that knee in line, and 3 o'clock. Again, keeping that knee right over those toes. Here's from a different angle. 12 o'clock, 9 o'clock, keeping those hips stabilized, knee over that ankle. 6 o'clock, and 9 o'clock. Perfect. And just one more time, 3 per side. Really fight for it. And last one. So this was just an introduction. This is level 1 knee stability. You'll be able to find level 2 knee stability in the link below in the description. So as always, guys, I want to thank you for watching this video, completing this video, testing it out, and trusting me to help you rehab and get yourself on a better track to live a pain-free life. If you know somebody in your life with pain, please refer them to this channel, guys, because it could give them relief that could change their life just like it is yours. Thank you for all your support.